Could you please repeat that? You mentioned having a knee injury about 10 years ago, correct? You were playing professional tennis and sustained a knee injury when you were, what, 18 years old? Now, if I understand correctly, you are 28 years old. You had a lot of potential. You went to train in the US, right? Okay, Then you had surgery to remove the meniscus, right? I got it. And your tennis career ended, right? Just hurt. And now your knee hurts after 10 minutes. You mean the intermedial part of your left knee? Somewhere around here? Yeah. Okay. So, with knee pain, you played professional tennis until you were 18, training twice a day, every day, right? You had a lot of potential. If you hadn't, you wouldn't have gone to America, right? Yeah. Well, that's how it goes.
A lot of strain jumping back and forth. The quadratus lumborum muscle is the first to suffer and stop functioning. Here's a square once again, let's mount it there. Roughly speaking, the quadratus lumborum in the lower back is the first. Why? Because the quadratus lumborum is a stabilizing muscle. It stabilizes the pelvis in relation to the spine. And during all his training, whether it was jumping or whatever kind of training in tennis, the quadratus lumborum muscle was in constant tension. Because I say again, it's a stabilizing muscle, and it stabilizes the spine in relation to the pelvis. If you have 2 training sessions a day, and that muscle is under tension, then he probably went to sit down to study or something. When we sit, the quadratus lumborum is also under tension. So what happens? Look, a person goes to a tennis training session. The quadratus lumborum is tense. The training lasts an hour and a half, and it's in constant tension and shortening. Then he finishes the training. What did you do after the training? Did you sit down anywhere? How many hours? All right, 5 hours. Then the young man went to study after training and sat at his desk. The quadratus lumborum was also under tension for all 5 hours. Why? When we sit down, when we take our legs out of the equation, and when we're sitting in a chair, the lower back, the quadratus lumborum, acts like a stabilizer. It keeps the torso upright so the body doesn't fall to one side or the other. They're like supports. So if you take away the quadratus lumborum here, a person can just fall off the chair to this side. So that's an hour and a half of training. It's under tension. 5 hours of sitting in class, it's under tension. And then the second training session, it's tense again. It never relaxes. What has this given us? In the end, this muscle stops relaxing and stretching, and trigger points start to appear in it. Trigger points in the quadratus lumborum. We're talking about the left knee because the left knee hurts. It shortened and pulled the pelvis up. There was an asymmetry in the lower limbs. So there's already a load. And he has a big load on his lower limbs. But it's uneven because one leg is shorter than the other, to put it simply. And it partially stops performing its stabilizing function. The small gluteals and the medium gluteals start to take over its work. And the gluteus maximus also shortens, but for a different reason. The thing about training in this sport is that a person is constantly sitting in a half squat, right? In a half squat, and he's constantly in this kind of stance. That's what the gluteus maximus is doing all the time. So she's tense the whole training session. It stopped relaxing and stretching and contracting. It developed muscle trigger points in the muscle. Here, here, here. It stopped performing its function. And the referred pain started from those trigger points in the sacrum, in the lower back, and already down the leg. Next, the medium gluteals started to take on some of the function of the gluteus maximus, along with the quadratus muscles. Again, it's overstrain. They're not doing their job. Overload. It's overworking. It goes into hypertonicity. It doesn't stretch. It develops trigger points. Referred pain from the gluteus medius, sacrum area, in the groin region, in the lower back muscle, in the glute, I said in the lower back. Then the gluteus minimus. She also decided to take on the function of all the muscles that are overloaded. And here, 1, 2, 3. Did you press it? Yes. Okay. Referred pain from the trigger points, especially the gluteus minimus, travels down the leg, along the lateral side of the leg, all the way to the foot. All the way to the foot.
Through the pain receptors.
So it can hurt right here. It can hurt right here. The reason is right here, and right here. What do we have? Right now, the quadratus muscle is shortened, the gluteus maximus is shortened, the gluteus medius is shortened, and the gluteus minimus is shortened. A huge load is now placed on the muscles of the back of the thigh. The semitendinosus, the semimembranosus, and the biceps femoris, extension. Holding, these muscles aren't working. These muscles also get overloaded. They are getting shorter. Trigger points often develop in muscles, typically in specific areas such as the neck, shoulders, back, and hips. These points can cause referred pain, which means the pain is felt in a different location from the actual source. For example, a trigger point in the shoulder might cause pain in the arm or neck. Understanding these points and their effects is crucial for effective treatment. Here. And there can be referred pain here too. So these muscles aren't working. These muscles aren't working. These muscles aren't working. The calf muscles are getting overloaded. The trigger point forms here, and here. The hamstring muscles. The posterior tibial is right here. The anterior tibial, the toe extensors, muscles responsible for extending the toes, such as the ones in the foot and ankle region, are known for referred pain that goes here and here, respectively. From the soleus muscle, it goes deeper into the knee area, into the foot, and up the leg. The soleus is a long muscle, and as it stretches, there's a chance and a risk of tearing the Achilles tendon because the muscle shortens and the tendon gets pulled. A sudden jerk can tear the tendons. The next stage is the formation of trigger points in the foot. In the foot. Where do they usually form? Usually right here, here in the foot, right here, yeah, right here. These muscles aren't working. All these various and different types of muscles, as well as the surrounding ligaments and tendons, put pressure on the knee joint. Actually, the main reason, about 70%, is the quadriceps. I'll just draw it like this, short and simple. Here is the wide medial, and here is the wide lateral, as you can see in this particular example.
Here. So, you see, and here's the tendon. The tendon of the rectus femoris, which is a crucial muscle in the quadriceps group, passes above the kneecap, which is also known as the patella, and attaches right here. So the rectus femoris, which is an important muscle for knee extension, attaches below the knee. It's also a bit rough here, especially when you touch it. Here's where the tendon attaches. This is just a cap. The knee doesn't really mean anything.
This is the muscle and this is the tendon. So what are the main issues here? When the back of the thigh is shortened, there are trigger points in it. It starts to work poorly, and it begins to pull and overwork the front of the thigh. Where does it mainly happen? Here, a trigger point forms, then somewhere in this area of the vastus medialis, and then right here in this area.
A lot of numerous and various trigger points form.
So the muscle itself shortens. It tightens the tendon. The tendon specifically extends under the kneecap. Here's the tendon part too. In particular, it also tightens and creates pressure in the area of the knee joint. It can be painful here too. Let's check. Is there anything? It's fine, I'm poking him, making it uncomfortable, and he's just sleeping. Well, join in on the filming. You'll need to show this to the specialists later. I'm saying, yeah, it hurts, I'm shaving. If it doesn't hurt, you won't die. What hurts, right? Am I hitting it? Is there anything here? No. Say no. So I didn't hit it, so I didn't find it. Right here. Right here, yeah, that's it. I just drew something in the wrong place.
One here. Huh. Here then. Is there something here? Yeah. There's something here. Two here. All right? We need to be very happy. So, on the front surface of the thigh, the main areas here indeed account for about 60% of the referred pain, right here, from the knee. Then, from here, we found a trigger point here that also refers pain to the knee.
And from here, in a broader sense, it can also refer to pain. It seems like the knee hurts. Now look, the trigger point is here, and the referred pain goes here. The trigger point is here, and the referred pain goes here. There are several trigger points here, and the referred pain goes here. Trigger points in the lateral part. Referred pain goes here. The muscle is shortened, the tendon is tight, and the knee joint is under pressure, being compressed from above, below, and behind. And the next muscle is the anterior tibialis. The anterior tibialis, here's the anterior tibialis, and here's the toe extensor. Trigger points also form here.
It hurts, it hurts, it hurts, it hurts, it hurts, it hurts. Okay, there is next. Here. Here. Even lower. Here. Less. Less. Okay, good. Okay. Here. Right here. Here. Okay. It's better here. Okay. All right. All right. But let me remind you one more time. Find the large posterior tibial. It forms how bad it is for him, the arch of the foot.
And the anterior tibial forms, turns out flat foot. But there's also the peroneal nerve running here. When these muscles are shortened, they might be less in the foot, less in the toes, less in the foot. Dysfunction. So, from them, there's referred pain, also the knee here, here. All those muscles I showed you start with the quadriceps. Knee hurts, what are we looking at? Quadriceps, lower back, gluteal muscles. All the muscles of the buttocks, muscles of the back of the thigh, muscles of the front of the thigh, calf muscles, and the muscles in front of the shin and the foot. And then you won't need surgery. And then you'll avoid surgery and continue your sports career because the knee itself can't hurt, just like the hip joint or a tennis elbow. The nearby muscles hurt, and the joint is severely and significantly damaged by the hard muscles that are continuously tense around the joint. It dries up, and everything falls apart there. And just the surgery, like in our patient's case, didn't solve the problem. The knee joint hurts too, but it's not the joint that's hurting. It's the muscles, and we treat the muscles. Today we have the 5th procedure. In the first procedure, he complained about his knee. In the first procedure, I didn't touch the knee. Was there something, quadriceps, glutes? He probably was really surprised. Second procedure, back of the thigh, front of the thigh. Third procedure, calf muscles. At the back, at the front of the foot. Fourth procedure, again, quadratus muscles, gluteal muscles. Since it moves, and the brain is limited, I would also connect the lumbar muscle here. It is shortened. It is shortened. Why do you need to do the lumbar muscle? Because the lumbar muscle here, it goes like this. It is attached here in the area of the trochanter. That is, it is attached to the leg, the lumbar muscle, and it is shortened, and it pulls the leg up, the leg up. He needs to do the lumbar subpalatine muscles for sure, because here, here, and here more. Here, yes, subpalatine, here. So we need to treat the knee pain comprehensively and effectively in a holistic manner. The surgery won't solve anything. It won't help.